And I have to tell you, a lot of people come into my office every week and saying, I can't wait for my 65th birthday so that I can finally get the insurance and the care that I need. I'm also, as I said, going to talk about how this bill even helps people age 50 to 65 with their health care problems. But right now, I want to introduce somebody who knows a bit about insurance, who knows a bit about health care, and knows a bit about what seniors in this country, what Americans in this country need when it comes to health care. He's a new member, but he's not new to this issue, and he's not new to advocacy for all good things for consumers and for the seniors, and that's John Garamendi from California, my colleague from California.
Thank you very much, Congresswoman Jan Schakowsky. And thank you for that terrific description of the history of Medicare. I mean, this has been a Democratic program for more than 43 years now. And Representative Jan Schakowsky, you just said it. I get the same thing. If I can just live long enough to get to Medicare. And I remember, as you were saying that, an experience I had. I'd visited a carpenter who had become ill with cancer, and he wanted me to stop by and see him. This was maybe 10 years ago. And he was bedridden, very, very sick. He was about 60, no longer able to work, and his wife was about the same age. And he said, I've just got to hang on long enough so that my wife can get to Medicare. Otherwise, she'll have nothing. And she's a diabetic. And we got about 45,000 Americans that are dying every year because they don't have health care and because they haven't been able to live long enough to get to Medicare. Medicare is a program that the Democrats have fought for, have fought very vigorous battles in this chamber against the Republican Party. You mentioned Newt Gingrich, who was right out front about the Republican goals in the 1990s to destroy Medicare. Well, we're here to protect Medicare, and in this legislation that will be before us for a vote very, very shortly, there is an explicit understanding and written into it that Medicare will be protected, that benefits will not be cut, and that cost savings, wherever they may be found in all of the Medicare system, that those cost savings will be plowed back into the Medicare program. So where are cost savings going to come from? How correctly you are with your chart when you talked about where the cost savings are. Well care, preventing illnesses, taking care of people in a continuity of care rather than episodic care. There's also a lot of fraud in Medicare. We know that. We also know that it was the Bush-Cheney budget that reduced the appropriations to fight fraud in Medicare. They basically wiped out the Department of Health Services and Medicare program ability to fight fraud, and it blossomed. But in the budget that you passed this last year, now that we have a Democratic president and a Democratic budget, you put money back in to fight Medicare fraud. That will save money. We've seen 60 Minutes. We've seen the kind of fraud that's out there. But what really, really makes me upset is the misinformation that's out there. In many cases, the downright lies that you see on television. Most of them paid for by the insurance industry that doesn't want to lose their 16% additional payment over and above the average cost of Medicare that's given to the insurance companies so that they can have this advantage program. What do the seniors get for it? Not much.